Okay friends, so welcome back, welcome in another video tutorial from microbiology with Shagni. So in this video tutorial we will going to cover EAEC. So it is not that much important that as compared to ETEC and EHEC. Okay, so let's discuss about it also. So it causes persistent diarrhea in young children without any kind of inflammation or fever, especially in developing countries. Okay, you know what, most of the ETEC, HEC, AEC all are occurring in developing countries. Okay, so they form a low molecular weight heat stable enterotoxin called EST1 and a hemolysin. Okay, so they have the ability to produce persistent diarrhea in young children without any fever or inflammation in developing countries, and they are producing low molecular weight heat stable enterotoxin EAST1 and hemolysin. Okay, so that is what they are producing, and they appear aggregated in a stacked brick formation on HEP2 cells. So these cells are called HEP2 cells. Okay, HEP2 cells. So these things adhere to the HEP2 cell and human laryngeal carcinoma cell, and here they are adhesins by which they are adhering with the HEP2 cell and human laryngeal carcinoma cell is not characterized till now. They are non-invasive and they do not secrete any kind of enterotoxin. Okay, and those bacterial cells have the ability to auto-agglutinate. Okay, so that is the all about enteroaggregative E. coli. You can remember by its name enteroaggregative. That means it have the ability to aggregate. They appear in aggregation, right? They appear in aggregation like a stacked brick formation on HEP2 cell or glass, and they have the ability to causing persistent diarrhea in young children without any inflammation and fever, especially in developing countries, and they form a low molecular weight stable enterotoxin called EAST1 and also hemolysin, but some of them also do not secreting any kind of enterotoxin. Okay, and they are non-invasive and their adhesins are not characterized, and they are adhered or they are aggregated on HEP2 cells. Okay, or human laryngeal carcinoma cells. So that is all about EAEC. So let's try to recapitulate it, that enteroaggregative E. coli, by its name we can easily finding it that aggregative means aggregation. So they are aggregated like stack big. So they are aggregating in a stack beak like formation on HEP2 cell or glass, and they have the ability to cause persistent diarrhea without any kind of inflammation or fever, especially in developing countries, and they have the ability to produce low molecular weight stable enterotoxin EAST1 and hemolysin. Okay, so that is the all about enteroaggregative E. coli. So thank you for listening to this class.